the PIO for Arapahoe County, and I'd like to welcome you tonight to Conversations with a Commissioner featuring our newly elected Commissioner, Carrie Warren-Gully from District 1. We thank you for joining us, and we're still dialing out to get more people on the line. As before we get started, I just want to go over a few things about how we run these events. These are normally quarterly events that we would prefer to do in person at one of your area libraries or city halls or things like that. Of course, with COVID, we have been doing these virtually since last year, and we probably will continue to do them virtually at least for another quarter or so, but we're really looking forward to joining everyone in person again as soon as it's safe to do that. These can go up to an hour long, and the idea is to have each commissioner in his or her district update you on the latest county business, the newest developments that we can tell you about, the kind of things that we're looking forward to in the coming quarters, and all sorts of things like that. Tonight, that will include a sort of basic COVID update about where we are in the dial and how our efforts are going to get everything reopened, to get people vaccinated and things like that. We do not have any medical experts on the call, of course, so we can't answer any real, hardcore medical questions about the virus or about the vaccines. It's more just going to be logistical kind of things. And then, in addition to that, we will, be providing all kinds of updates about all aspects of county business. So, if you want to ask a question and you're dialing in on the phone, you should dial *3, and that will push you through to an operator, and they will put you in the queue to get you lined up to ask a question. And if you're watching this on Facebook or on our website, you can just punch a question into the comments section, and we have a dashboard here that we can review those, and we will ask those of the commissioner once we've finished our presentation. So with that, I would like to introduce Commissioner Carrie Warren-Gully.
Hi there, how are you all this evening? Thank you so much for joining us on this chilly, cold Colorado evening. But we're glad you're here, and we have a lot of information to share with you. So I think we just go ahead and start, right, Luke?
Yep, start the slides.
Great, thank you. Well, as I said, welcome to everybody, and I appreciate you being here. We have lots to share with you, and we will go ahead and start with some of the new updates to what is happening on fighting and the COVID situation that we're in. So the county with the new dial, there was a new dial that the governor put together with some improvements from the previous one. So we're calling that dial 2.0. And that means that currently the county is in level yellow, which is great because that means that number one, we've really started bringing our incident rates down, and we're keeping our hospitals open for any cases of real need. And that is a wonderful thing because that means that people have really worked hard to follow the parameters around wearing your mask and being socially distanced and washing those hands. So we're really doing our job. We're doing the work that needs to be done. And that means that now we're in level yellow. And realistically, what that means for our business community is that it opens up more opportunities for them to have better opening, better occupancy, and that type of thing, particularly in our restaurant and entertainment organizations. So, as I said, we've been improving, which is a wonderful thing. We also have opened up a 5-star certification program in which our businesses can apply to. And we have, I think over 250 businesses that have applied to be in our 5-star program. And what that means is that these businesses are making a commitment to really do the work that they need to do to keep our citizens and our community safe. And they've made a huge commitment to do that. They have put in certain procedures and worked very hard with the county and local cities and municipalities. They have had someone come in and inspect their place of business, and they've been approved for the 5-star program, which allows them to participate in this program. Once we reach certain marks and certain goals, they will then be able to operate in a level below where we currently are. And that is good news for them because, again, it opens up those opportunities for higher occupancy. We're also working very closely through the Tri-County Health Department with our state and working very hard to put in place a logistical system in order to distribute our vaccines. As you know, the first level of vaccines were given to people in our healthcare industry, people that were working in hospitals and in healthcare. And many of those folks have been vaccinated. They then opened it up into our first responders. So people in fire departments, our emergency medical people, as well as police force and that type of thing. Those folks have also been really coming in and getting those vaccines done. And that meant that we could then open up the opportunity for anybody over the age of 70 to receive vaccines. So the important thing to remember is that all three of those groups are still eligible and are our highest priority to get vaccinated. The hard part about all of this, as all of you know and have been reading probably in the newspaper and seeing on TV and hearing in radio, that unfortunately our supply is lower than our need. So we're working very hard to work with our community partners, many of our hospitals and healthcare organizations, as well as some of our local pharmacies, like our King Soopers pharmacies and folks like that, that are working to get folks vaccinated. They have a higher capacity to give out vaccines than we currently have supply. So we all know that that's a goal of ours as a country to work on that and increase our supply. And once that starts happening, we'll have more and more people. The goal that the governor has set forth is that 70% of our 70 and older folks, as well as those healthcare and first responder folks, will receive vaccinations by the end of February. The exciting news also is that they have started working on vaccinating some of our most essential frontline workers, as well as people that work in school staffs, teachers, as well as the staff. And I know that those folks are already receiving vaccines, and that's a very good thing, which means that our economy is opening up a little bit more, as well as our schools, which allow for just a little bit more of our economy to open and people to have more freedom in that sense. So all of that is taking place. We are looking in the long term, or at least I should say Tri-County Health and the county are working together to look into the future and think about what happens when we really do get to the point of where they're able to supply the vaccines that we need and we're able to get people vaccinated at a higher rate. And our county and Tri-County are working very hard to make sure that the logistics are in place to make that happen. And then we're all on the road to hopefully by the end of this year, as the president said last night in his town hall, have a good closeout to 2021. So on the next slide, we're going to talk a little bit about how we've been providing economic relief to our community. The county, Arapahoe County, received $114.5 million from the Federal CARES Act. And that money came to us, and we immediately decided this needs partnership and collaboration. So we started working very intensely with our municipalities and the 13 communities that we have within our county. $51.6 million was shared out to those 13 different communities. Our thought was that the closer we get to the people in the community, the businesses in the community that needed the support, the people in the community that needed the support, the closer we get to them, the more efficient and the more effective this relief will be. So we shared that with our communities, and we have also shared with a lot of other partners as well. We've provided lots of businesses, $16 million in grants to local businesses in our county, as well as I know many of the cities decided to use some of their funding for business relief grants as well. We've helped a lot with rent and mortgage assistance so that we keep people that might be on the brink of losing their home situation. We've kept them in their homes with their families, and that's incredibly important. We've also worked very closely with some of our nonprofit health centers, food banks, homelessness partners, addressing behavioral health issues, physical health, and food and housing insecurity. So we're working very closely with a lot of those partners to make sure that we're getting the resources to the people that need them. We also are working with some of, as I said, some of our kind of our nonprofit health centers like Stride, Lincoln Health, and Mako to provide some testing sites. Support, we've also kind of been working on facility improvements consistent with best practices and providing PPE for all of our guests and our employees in our buildings so that the county could start opening up and we could continue to service folks that needed county services. So all of that was possible because of the CARES Act funding, and it really was a lifeline to us. On the next slide, I want to share with you some of the work that we've done with our Community Resources Department. This is, again, some of our business relief programs. We have also received a little bit of additional funding from the state to implement some small business relief grants that are very specific to restaurants and gyms and entertainment centers that have been very dramatically affected by by this COVID. We've also been working very closely with Arapahoe Douglas Works, which is our workforce development center. We have been having job fairs, skill classes, and the wonderful thing about it is that all of this is happening online. So as people are looking for new jobs, maybe they want to increase their skill set, they're able to do that online and from the safety and security of their own homes. We're also helping our business partners at Arapahoe Douglas Works to find employees that they're looking for. So we're trying to match people that are looking for jobs and businesses that are looking for employees. So that's been a very, very important part of the work of Community Resources. They have also worked very hard to start targeting some of their programs for veterans and seniors. And that means that we're talking about resources like Meals on Wheels and other types of services. And we are very excited about the fact that we now have a staff person that is specifically focused on assisting veterans and making sure that they're receiving the benefits that they need. So if you are looking for some workforce development or are looking to try to match yourself with an employer, I would suggest going to the Arapahoe Douglas Works website, which is at adworks.org. All right, I think that was everything I needed to hit in community resources. So on our next page, we have human services. And human services is really our program in the county that takes care of some of our most vulnerable people and people that are really on the brink of homelessness, potentially, families that are trying to find a safe place to be. And we have found that, of course, some of these services have had increases in the amount of people that need the assistance. So the CARES funding was very impactful in our human services programming. So again, some of that funding went towards supporting local food banks that were already existing in our community, but it also works very closely with some of our behavioral and physical health organizations to make sure that people are getting the help that they need on that end as well. We've also had a very exciting program that is fairly new to the Human Services Department, and that is our Goals program, which stands for Generational Opportunities to Achieve Long-Term Success. And this is a bridge housing project which serves families, and it's families that are experiencing homelessness. And those families receive not only a place to live and find housing, but it also provides job skill training. It provides tutoring for the children in the family. It provides workforce skills as well. And it's really meant to be a two-generational program, meaning that we're not only working with, say, the parents or the children, we're working with both sets of generations, as well as sometimes we even are working with three generations, grandmas, grandpas, and the individual families. So it's a holistic approach at looking at what are the underlying issues that can be stabilized in order to provide a more long-term setting for the family. We also have child and adult protective services under our Human Services Department. And this is, unfortunately, has seen an increased demand as a result of some of the economic and social fallout that has happened in our community because of COVID. So it's human services is such an important part of the work that we do in our county. So on the next slide, I want to move us a little bit away from some of the conversation around COVID and speak a little bit to our 2021 budget. We are feeling fiscal restraint, as we all will see in our lives during this time. And because this year is a property tax assessment year, we are still looking at how is our budget going to be affected by our property values. As you know, our property taxes are one of the only ways in which the county's efforts are supported. So we need to make sure that we have a good understanding of that. So we really won't know until the end of this year kind of what the effects of COVID have been on our budget. But with that in mind, we are working to try to find and try to work on a new strategic plan, a plan that makes it so that we are setting standards for ourselves so that we are working within our budget in a sustainable way. And that means evaluating every part of our county, all of the services that we provide, to make sure that we're doing that in an efficient way, but that we're also doing it in a way that serves our community the best. We might be needing to eliminate, or we will be eliminating, any unnecessary expenses whenever we can in all of our departments. So we're working on audits with all of our departments and having them come forward with new ideas and new ways of doing things. We've also been very pleased with how we have been able to transition some of our services to more of an online platform because of COVID and the need for us to kind of turn on a dime and start doing that. So we're really evaluating what services can we continue to do in that manner? Is it a more cost-efficient way of doing things? And so we're really evaluating those county operations and taking a look at that. One of the hardest parts about our budget is that we do have a lot of infrastructure. Not only our roads, whether they're paved or gravel, but we are maintaining them, our bridges and roads, but also our buildings and the infrastructure that we have just in our buildings. So unfortunately, those age just like our houses do, and we need to continue to make investments in those infrastructures. But we also need to understand that many of them have some very high demand use on them. So we're really trying to take a look at what are we able to maintain, what is kind of backing up and we're not able to maintain, and what of our infrastructure do we need a little bit more fiscal focus on, so that we're really taking care of that, and we're may need a little bit more capital investment. So we have some challenges ahead. We are going to be looking to our community to see what their input is and how what they feel services are important in our community, and ways that we might try things differently. So be looking out for that and looking for ways in which you'll be able to give us a little bit of input. So the next slide brings us to a topic that I'm sure many of you have become familiar with, if you weren't already, due to being a little bit more socially isolated, and the ability to be able to be together a little bit more when we're in the out of doors. We're so lucky in Colorado that we get to live in such a beautiful state, and Arapahoe County really has some absolutely amazing opportunities for us to be in the outdoors and enjoy that. So we are in the process of completing an open spaces master plan right now. And that means that we're really trying to take a look at what do we currently have, what are some goals that we would like to take a look at, and how we would like to improve what we have, and also taking a look at how do we continue to maintain the properties, the trails, and all of that we currently have. That our open space is supported by a quarter-cent sales tax, and that's what funds many of our parks and trails and open spaces. And that is due to expire in 2023. So more than 62% of the funds that we take in the open space are actually shared back with all of the municipalities and the special districts that we have. So again, that word partnership and collaboration is so important, and it is an ongoing value of our county. I can speak from experience as a previous school board member on Littleton Public School Board that we partnered very closely with the cities of Centennial and Littleton to improve and update many of our playgrounds on our schools that we were then able to open up for the public to be able to enjoy and use as well. So those partnerships work very well, and I can attest to the creativity and the effectiveness of these funds. Finalizing the master plan is going to help us fund those or think about how we want to deal with those future needs within our county. So we are considering moving forward to ask the voters to renew that open space sales tax. Again, I want to reiterate that open space sales tax not only helps us improve what we have and purchase new properties, but it also is what allows us to maintain what we currently have. And it's very important that we have these funds in order for that to have that maintenance, because the county fund, as we just talked about in the previous slide, really has some fiscal restraints. So we want to make sure that we're having a conversation, and we would love for you to be a part of that conversation as we move forward with the master plan and conversations around asking our voters to continue to support that sales tax. All right, moving on from open space, we move to our transportation master plan. And boy, you cannot live in our county without realizing that we definitely need to make sure that we're continuing to update this master plan. It's a very hot topic in our area, and I was amazed when the Public Works Department told me that pretty much our traffic is up to about what pre-pandemic traffic was. So we are back on the roads, we are back utilizing our roads, And we need to make sure that we're really planning for our future. As you know, Arapahoe County is one of the largest counties in our state, and it's one of the fastest growing counties. I mean, a lot of people predict that we will eventually become the most populous county in our state, which means that we really need to have a lot of focus on making sure that we're planning for that growth. The great thing about this is that we're really trying to involve all of those municipalities and other entities that we work with at the state and federal level to make sure that our plan is works in cohesion and in collaboration with those entities, and that we're all coming to the table with what we have in order to develop this more collaborative approach to taking care of funding. We do ask for citizen participation and input into our transportation master plan. And you can see on the slide there, if you go to arapahoegov.com/transportation plan, you can take a look at some of the work that we're looking at and considering and give us your input as well. I will say that I'm sure it's included in this master plan, but there is also another effort being taken in District 1, in the area where we all live, in the western part of the district, and that is along the Santa Fe corridor. So again, not only looking at Arapahoe County, but looking at the counties to the south and the north of us, and looking at the development that's happening along there and how we're going to work together to solve some of the congestion issues that we all see on Santa Fe. I live in Littleton, my parents are in Inglewood, and my brother lives over on the western part of Littleton. And so I am on Santa Fe a lot, and there is a lot of congestion, and we need to be addressing that. So that is a specific group that is looking just specifically at the Santa Fe corridor. And that is happening through the Colorado Department of Transportation. I'm sure you're aware of the fact that down in Douglas County, Sterling Ranch is a large development that's going in down there. And that is why we really need to be partnering with counties like Douglas County, because that growth that is happening there will certainly have an effect on transportation routes going north into our cities proper and on into downtown Denver as well. So I think that's everything that I have to go through right now on our slides, but I think Luke and I are going to cover a couple of other topics too.
Indeed we are. Thank you, Commissioner. Very informative, and I just want to remind everybody who is on the line on the phone or online watching us, if you'd like to ask a question, you can dial *3 on your phone and be put through to an operator, or you can type a question into the comment section either on Facebook or on our webpage. One thing I want to remind everybody is neither the commissioner nor I are medical people, so we can't answer very specific medical questions about COVID or the vaccines. I would continue to refer everybody to the Tri-County Health Department for more information about things like how to sign up, getting on lists for wait lists for the vaccine and that kind of thing. That's Tri-County is at tchd.org. And their general line is 303-220-9200. And I believe they have expanded hours now on their phone lines. So you should be able to get through there and get some of your more specific questions answered. Generally speaking, we're encouraging people with the blessing of the medical folks to sign up in multiple providers for a vaccine. If you so wish, just make sure you keep your appointment and cancel the ones that you don't need after you get it. And then just keep monitoring our site, keep monitoring Tri-County and the CDPHE site, which is the state health department site. And you will be able to find information as it develops. Obviously, it's changing very quickly. They've had supply issues at the federal level. This week, we had this terrible weather across the country that seemed to have compromised a lot of the distribution plans that they had. So hang in there. We really appreciate everybody's patience with all this. And we, of course, will be providing more information as time goes on. And we probably will have another vaccine or COVID related town hall with all the commissioners, and inviting guests from all over the county, not just from certain districts. So keep your eyes on our website for that. But let's talk a little more with Commissioner Warren-Gully. I mean, you've only been on the job about 5-6 weeks. We've thrown you into the deep end of the pool in just about every possible way. Why don't you start by telling us a little bit about yourself and how you arrived in this position?
Well, I grew up in Inglewood, and I guess I should say, I always say Old Town Inglewood, so kind of around Swedish Hospital area, and went through Inglewood Public Schools, got a great education there, and actually met my husband in the Inglewood Pirate Marching Band. So it kind of, the history wrote itself there after that, and 31 years later, my husband and I have 3 children, and we moved to Littleton, and our children went through Littleton Public Schools, 3 sons. And we've had a great experience in Littleton schools as well. I started off kind of working in the nonprofit arena and did a lot of education programming in the nonprofit arena. And when I was paying more in childcare and federal taxes, I decided that it was time for me to stay home a little bit and be with our boys until they were in school and I could get back into the workforce. So I started volunteering in the schools and on some different district committees, and really started getting interested in public education in the state of Colorado, and more specifically around education funding. So I got very active down at the state capitol and really advocating with our legislators and working on initiatives to make sure that we were funding our schools adequately and that we were taking care of students in an equitable way. And that is what kind of got me to be interested in being on the school board. And so I ran for the school board and have been serving on the school board for 7 years. And just absolutely loved my work doing that, and really enjoyed the process of working at the local level. I did see a few things as a school board member that the county did, and started realizing that the county is the organization that really supports our community and our families, and in particularly some of our most vulnerable families and students. And so that's what got me interested in taking a look at running for county commissioner, because I felt that many of the services that we provide through our school districts really needed the support of the county and the programming that they do. For example, families that have some food insecurities, or students that were experiencing homelessness. Obviously, our schools are big, are very important reporters of children that are in potentially violent situations at home. And so we want to make sure that they're able to do that. We also found that there was a lot of mental health needs that were happening in our schools and with our young people and in their families. And we did not have the resources as a school district to take care of that. And so that also led me to have an interest in taking a look at running for county commissioner. So I was very excited to take a look at that race. I was so thankful of all the support and help of people to get me to this position, and I'm very excited to do it. Outside of being on the school board, I also started a company and a business. We have 21 employees that work, or staff that work with us in our business. And we are a audiobook production company. Our largest client is the Library of Congress, and we do audiobook recordings for the blind and print impaired. So it was absolutely fascinating experience. I learned a lot about being a small business owner, a small to medium-sized business owner, and what that means and what that takes, and how we support our employees as well. So it has just been an absolutely fascinating experience working with the chambers and learning about the business side of work as well. So that kind of gives you a little bit of my background, and I'm very happy to be representing District 1. It's the neighborhood that I grew up in, and my parents and my in-laws and my brother and sister and many of my siblings still live in District 1. So it has a very special place in my heart, and we have some amazing communities, some real historical communities that bring so much to the county.
So you were an advocate at the legislature while you were still just a private citizen.
Yes, yeah, yeah.
What Yeah, talk a little bit about that, and like people on the call, if they if they're thinking about getting involved, like what kind of advice would you give them?
Yeah. Well, I guess the way I look at it is that, the state capitol is our house as citizens, and there are so many issues. My issue happened to be education and education funding and working in that arena. But the legislators are working on a whole host of different topics, and folks are working very strong on a lot of different fronts. But yes, it's really a great way of interacting with your legislators and really becoming acquainted with them. They want to hear from us. They want to hear what our input is and what our experiences are. And if you have a passion for a particular area, it's great to bring that forward because, a lot of times they're hearing from lobbyists or people that get paid to go down and interact with our legislators. So when they are interacting with people from the community that they represent, it means a lot to them. And it is incredibly impactful. And I will tell you that what I did was I found a couple of organizations, nonprofit organizations mostly, like Great Education Colorado, um, and they also provide avenues to go down and advocate with your legislators as well. So if mental health is an important topic for you, there's several organizations that plan legislative days for their advocates to come down and start interacting with their legislators. But I have found too that, once you start interacting with your legislator, you are able to call them and send them emails and give them information. And I have found that most of the time they're very open to hearing from you.
Yeah, I agree with that. My wife is a small business owner in Denver and has gotten a lot more active since COVID started and has realized, if you reach out and are persistent about it, you can actually get a dialogue going with the relevant people. So that's really useful information. To continue on that a little bit, you got a closer look at the county itself through your work with the Long Range Planning Commission. So how did that affect your desire to become a commissioner?
Well, the Long Range Planning Committee, as it suggests, looked at all sorts of different things, and we really touched on a lot of those topics tonight in our conversation. Arapahoe County is growing. It's going to keep on growing. We've got a lot of room, particularly in the eastern part of our county, to grow. And even some of our more historic towns and cities like Inglewood and Littleton and Sheridan are seeing lots of growth as well, as maybe multifamily apartments and duplexes and things like that are in the community. We have more people in our community, and it's just becoming more populous. So we are seeing a lot of growth, which is really wonderful and exciting. Lots of opportunity for economic growth, but it does require some planning around that and some real strategic thinking about how do we take an infrastructure that was built for 400,000 people that is now 650,000 people in our county and will continue to grow. So how do we take care of that infrastructure that we currently have, and how do we effectively and smartly expand our infrastructure so that we're continuing to serve the new people and the new residents that come into our community? So the Long Range Planning Committee really gave me really great insight into what were some of those issues? What areas are really going to see the biggest impact because of that growth? And what are some of our options? And on that committee, I was a citizen representative on that committee, but we had all sorts of people from businesses, the nonprofit arenas, and we also had several cities that sent representatives, chambers of commerce that sent representatives to serve on the committee, and really got a great education on what were some of our needs. So that gave me great insight when I decided to run for county commissioner of what are some of our specific needs and areas of growth that we're going to have to address.
That's great. Yeah, they're really, I would encourage everybody to take a look at our website and particularly look at the boards and commissions or committees, boards and committees page, because there are quite a few opportunities for citizens to get involved. And especially if you have expertise in a particular area, you may find that there's something there for you at some point. So I am going to take a phone question now. And just to remind everybody, if you're dialing in and want to ask a question of the commissioner, you just dial *3. You'll be put through to an operator. And if you're online, you can type a question into the comments field and it'll come up on our nifty little dashboard here. So here's one from Barbara. I can answer this partly too if you don't know the exact answer since you're new. But here's Barbara. Barbara, you are live.
I'm here. Hello. Glad to meet both of you. I actually have two very brief questions. One is, when this is great. First of all, I get this phone call that this meeting's taking place. Do these phone messages go out to just landlines, or do they also go out to mobile phones for people who live in Arapahoe County? That's question one.
They go to primarily landlines, but we do have a mobile dialing thing as well. And we would encourage all people to come to our site, sign up for newsletters and things like that. And that's a good way to get your name in our system.
Because I have a couple neighbors who have landlines like myself and some that don't. So I will get this information out to them. The second one is your idea of having a virtual meeting. First of all, this idea that, well, you only do it a few more times because then everything will get back to normal. We have to get over this idea of back to the new normal, which people are really wanting to go back to the way it was. It will never go back. Sorry, I'm working on my PhD in bubonic plague on the Silk Road, so, hear me out on that. I'm really glad to hear about this because I've lived in Arapahoe County since 1982, and I didn't know you had quarterly meetings. I didn't know you had quarterly meetings in libraries and town halls and city halls, whatever. This is the second time I've ever known that you've had one. So I guess your predecessors weren't very good at getting the word out, and you guys are a whole lot better. So raise your right hand, give yourself a well-deserved pat on the back. So my comment is about virtual. Even if the day ever comes that it's safe for us to be in the groups of more than 10, I think this idea of virtual is great because if the weather's bad, like it's snowing outside right now and people can't get there, or they want to listen in or ask a question and they can't get a babysitter, or they're not feeling well and they don't want to take their germs with them, we'll still be able to meet. So maybe the day comes when we can meet in person, but I guess my suggestion and question to you would be don't ever get rid of the virtual because that's going to be helping you too, so that everyone knows what you're doing.
Well, Barbara, thank you so much for that comment. And I think we completely agree, don't we, Luke? I think our vision is that we would probably do some kind of hybrid event where we would have the ability for people to come in person if they preferred that, but we'd also have the ability for people to listen in or quote, attend virtually and still have the ability to ask questions and stuff. I will tell you, I've been so excited, Barbara, by how many people actually are joining in on a lot of these opportunities. When I was on the school board, we had hundreds of people that would call and listen in to our school board meeting, which typically we would have maybe 5 or 6 people in the audience when we were doing it in person. So virtually does allow for us to get a lot more input and a lot more participation, and quite frankly, able to get our information out to folks in a really, as you said, convenient way so that you can be home and maybe even eating in your pajamas while you're listening in.
Right, like I am. So actually, I have two good bits of news for Barbara. One is what the commissioner just said, which is we are going to continue to do this virtually even when we return to in person, because of the fact that we can get so many more people. To give you an idea, we have almost 500 folks on the call tonight, which is fairly standard now since we've been doing them virtually. And then the other piece of good news for Barbara is she hasn't really missed that much, because we only started doing these quarterly events last year. And we started with Q1 in person, then COVID hit, so we skipped Q2, and then we did Q3 and Q4 virtually. So this is only the fourth iteration of the conversations with the commissioner, online or in person. We've just really been interested in expanding the engagement opportunities for all of our commissioners. So this is we're thrilled that you're thrilled with this, and we are going to continue to do it in multiple ways that will give everybody a chance to meet everybody in person or virtually and get their questions answered. So. And with that, let's go to some more questions. You've mentioned a couple of things, Commissioner, that you have focused on in your past life before you were a commissioner, and that's education, some mental health stuff, things like that. What are your priorities as a commissioner? I know you're the liaison for our human resources and finance departments, but what sort of things are you planning on focusing on in your early term here?
Well, it's a funny question, Luke, because I'd love to say, oh, my passion is this, and this is what I'm going to move forward with. But obviously, there are some areas that I feel very strongly about. I'm the daughter of a psychiatrist, so mental health for me is very, very important. And so I'm trying to learn as much as I can about the resources that our county can provide to individuals and families that are experiencing any type of mental health situation, whether that's drug or alcohol, substance abuse, whether that's a severe mental health issue, or whether it's just something that right now we are seeing a lot of people that are just experiencing very, very severe anxiety or feelings of isolation and depression. So we really want to make sure that we are not only is the county working on providing some of those services, but we're also very interested in trying to work within our with our community partners. And again, I kind of keep bringing that partnership opportunity up and talking about how important that is. The county is never going to have enough funding to take care of all of our mental health needs, but we can be one part of it, and we can also be somewhat of an umbrella organization that tries to bring together all of the entities that are working in the mental health arena, so that we're making sure that those services are not duplicating each other, and that we're doing the best that we can to get the right resources to the right person at the right time. So that's one area that I have a big passion for. The reason I kind of chuckle at that when someone says kind of, what are you going to do in the first 6 months of your commissionership? And I always just kind of think to myself, oh my gosh, what am I going to do? Because right now, I was telling my husband the other evening, I'm just drinking that from that proverbial fire hose. And my husband laughed at me and he said, Kerry, you're not drinking from the fire hose, you're drinking from Hoover Dam. So, and it does feel like that sometimes to me, that I just am really taking in a lot of information. But what I will say is that I have been incredibly impressed with the staff that we have in our county. They are such a committed and passionate group of people. They care very deeply about the work that they do for the county. They're committed to the county. It's not unusual for me to get on one of these Zoom calls with a department from the county, and maybe there's 5 people on the call, and each of them have 10, 13, 20 years worth of experience with the county. So they know their job well. The county does a good job of trying to retain that talent. And I've been very impressed with that. So I guess my answer to your question, Luke, is the first probably 6 months to 12 months is going to be a real learning curve for me, and learning about that and learning about the county, all the programs that we provide. And I know that I will find plenty of passions to kind of keep following. One other area that is very important to me, and particularly because of the district that we live in, District 1, and that is the work that is happening with our Tri-Cities around homelessness. And when I say Tri-Cities, that means Inglewood, Sheridan, and Littleton are taking a look at our unhoused population in our county. We are seeing an increase in that because of what is currently happening with COVID, and people who were just barely hanging on prior to COVID and now have lost their job or had some kind of financial impact from COVID, whether that might be a health care expense, and they are now unhoused. And so I have been incredibly impressed with the commitment of these 3 cities to try to work on homelessness. They entered into a contract with the county and the University of Denver to study homelessness in this area. And I think it's really great the way that they tackled this was because they wanted to find out, number one, who is homeless in our area. And our area is different than, say, downtown Denver or, in Jefferson County. We have unique people and unique situations in our county and in this area. So they wanted to find out who specifically is homeless. Is it mostly families? Is it single people? Are these people that have just, for the first time ever, experiencing homelessness, or are they in chronic homelessness? And then once we kind of found that out, what are some steps or what are some things that we might need to do, areas that we need to address? And what I found very fascinating about listening in on the study and the report that was given to the Tri-Cities area was that the acknowledgement that we're not ever going to end or eradicate, or if we do, it's going to be a little bit down the road from now, eradicate homelessness. What we want to do is make sure that if someone is experiencing homelessness, it's as brief as possible, and that it only happens to them once. It's not going in and out of it. We're not seeing chronic homelessness. We're really trying to provide those support services that help someone gain the skills and get the support that they need. So, for example, if somebody has a substance abuse issue, we're not only trying to help them find a place to live, but we're also helping them address that underlying issue that is keeping them from being able to have a job or maintain the lifestyle that they want to remain in their housing. So we want to make sure that we're addressing all of those issues. We want to keep it brief, and we want it to only be a one-time thing. I will say that it is hard in our area because particularly in the Tri-Cities area, we are seeing more families that are experiencing homelessness. And we need to make sure that people are being identified correctly. So, for example, we're not talking about people that literally are out on the streets with nowhere to live. We're talking about people who might say, I'm not homeless, but they're living out of their car. I'm not homeless, but I'm living with my aunt this month, and then I'm living with my friend next month, and that type of thing. So it's a very big issue, but it's something that I'm incredibly excited about, the fact that the county and the cities are working together to try to start tackling this issue. So I think that would probably be my two top issues at this point.
Well, and as we've seen in numerous ways, it seems like if there is a silver lining to COVID, it's that it has increased our collective focus on homelessness and, really an active seeking of creativity and solutions that really can help. And then, as you mentioned, the partnership factor between communities is really important as well. We have time for a couple more quick questions. I want to knock one out here. Someone
Okay.
is asking when and where does the Council on Aging meet? And I looked this up. It's the Arapahoe County Council on Aging. Their website is accoa.info, I-N-F-O, and they appear to meet every couple of months. The last one was at the end of January, so I assume that the next one would probably be sometime in the next month to 6 weeks or so. So I would encourage anyone who's interested in the Council on Aging to visit accoa.info, I-N-F-O. And then another question for the commissioner. You were talking a few minutes ago about getting back to normal. What in your estimation, based on what you've learned so far in your many meetings, what are we identifying as normal officially, as far as either medical metrics or anything else that that might get us to something resembling full businesses open, people out, concerts again, that kind of thing? What's your understanding on the board?
Well, I will say that a big part of that obviously is vaccines, being able to get people vaccinated, vaccinating as many people as possible. And that's clearly why we're starting with some of our most vulnerable populations and then moving down the line from there. I do think getting schools open is a big part of that. And I know that the schools in this area are working very hard to make sure that we are open, our students are in person, and as much as possible to do that. And our families have the opportunity to be back working as fully as they choose to be. Normal is a really interesting question, isn't it? And I'm sorry if I've used that term flippantly, because I think it's going to be, as Barbara said, a new normal. And I think there's a couple of things that we need to be thinking about with that. Number one, I think we want to make sure that we're providing as many opportunities for people to be together as possible. So I have heard that some of our summer festivals that typically happen in these around here, there is discussion around, can we do those or can we start those in a way that maybe doesn't have as many participants, and we are able to keep people in a safe situation. So, for example, I'm very proud of the fact that the folks that work out for Arapahoe County that work out at the fairgrounds, they have already come up with a couple of really creative things that they're hoping to do this summer when we can, of course, be outside, which allows for a little bit more expansion of number of people. But they're also going to do a really fun 5K run series where they're going to be in different parts of the county utilizing a lot of our different trails and open spaces for a very limited number of participants. So be keeping your eyes open for that. So I think we're going to start seeing more of those types of things, and it won't be as a large scale as possible as it has been in the past. I think what to me would feel good is if when people start feeling comfortable about being in the community again. And again, I think that is going to look different for some people. I think probably masks are going to be around for a long, long time for people who want to feel more comfortable utilizing them. My husband is a classic example. He's decided that he's never getting on another airplane again without wearing a mask. So it may look different for some people and in different situations. Medically, I don't know, and it's a good question. It's something I should ask Dr. Douglas, who heads up our Tri-County Health Department, to kind of start thinking about that and getting people ready for that, of what does that look like. But I certainly think we need to be addressing an economic recovery. And obviously the lessening of restrictions, the more that people can be out in gyms and going to concerts and going to theaters and restaurants and all of those things that make our communities vibrant. I know in Inglewood we have the Malley Center, which is a wonderful recreation center and community center for our senior population. We want to make sure that those are up and they're functioning and they're operational and as full capacity as possible. And then acknowledging that some people will always probably move forward with some of the restrictions that we've put in place right now. I don't know. That's a very good question.
Yeah, there certainly are a number of intangible aspects to it that are really hard to quantify or put a date or a number on. But I agree that I think it's going to feel normal is going to feel different to different people, right?
Yeah.
But the idea is to get as many people as possible feeling like they can resume the stuff they used to do before all this started. So.
Yeah, I think the being together as families is a big part of it too, don't you, Luke? It's. I hear so many people say, "I miss being with my family. I miss being with my friends, and just having people over for dinner or those types of things." And that will make me feel very normal for sure when we can get there. And
Absolutely.
I think we need to acknowledge that a lot of this is going to come from the federal level as well. I mean, if we can really move forward as a nation to focusing in on getting our vaccines going and supporting our schools so that they can open up and making sure that we have resources in place to open as much as we possibly can, that will be very helpful so that the state then can use that as a springboard to move forward as well.
Yeah, there's definitely a domino effect across that whole thing.
Yeah.
All right. So we've reached our hour. If we were unable to answer one of your questions, you can email the commissioner at cwarrengully@arapahogov.com. That's correct, right? And
Yep.
No hyphen?
No hyphen.
Okay. All one word, cwarrengully. And when in doubt, visit our website and look around for, do a little search for what you're looking for. If you still can't find it, feel free to call our main line, whose number is escaping me at the moment, but it's available on our website. And I'll try to hook you up with the right information. We always welcome citizen engagement. Commissioner mentioned it in the context of the Open Spaces and Master Plan, Open Spaces Master Plan and Transportation Master Plans. Also, the strategic plan, we welcome community feedback on that. So just get in touch and ask us what you want to know, and we will find the answer for you. So thank you so much, Commissioner, and we look forward to the next event.
Thank you to everybody for joining us this evening, and have a great rest of your week.